colleagues who are in the TNO Wellness Committee, a warm greeting and a good evening to all of you. I think it's high time we started talking about the most important issues that are actually bothering us in the sense doctors. And though we are experts in disease, sometimes our knowledge about health is sometimes just on par or maybe even less than our patients, probably. So with this particular idea, we started this question. And every good idea starts from a very good question. Why is doctors' life expectancy less than most of our patients? And with this idea, we processed a few questions and we have come to an action plan. Considering this is a very stressful topic that we have taken, I thought we should start with a relatively happy, light-hearted note. Right? So no problem, I think, is serious enough to get tense. There is always something you can laugh it over. So with this particular idea, the TNOA Wellness Committee came up with a plan to empower and motivate doctors to take up their health seriously. And within this gamut, we have brought in physical fitness, the importance of nutrition, the importance of sleep, and of course, the most important, mental wellness as the 4 pillars of FFA or Fitness for All. As of now, FFA is a WhatsApp group for TNOA members, ophthalmologists. And for non-members and non-ophthalmologists, you can follow our channel. I hope in the coming years, we can increase our spectrum to include doctors of other specialties and even professionals of other allied issues. I would have the pleasure of introducing our panel, and since Dr. Nirmal has already done the honors, I think you will know for sure why we've chosen them. You can see that from the photographs. Despite surviving the turmoils of practice in different cities and through various levels, you can see that their smile is intact and their charm has only increased with the years. So a warm welcome to the 3 elite ophthalmologists of Tamil Nadu who are going to offer an ophthalmologist perspective to stress in the professional field. Of course, introducing our guest faculty, Dr. Prithika Chary, is a unique honor. I've taken a week trying to find out everything about her, and a week hasn't been sufficient. Her titles and accomplishments run into pages. And if we take up that, we're going to end up our time for the webinar. She is the first lady neurologist and neurosurgeon in India. She's also an image consultant, a resilience coach, an NLP master practitioner, and soft skills trainer. You can Google all these terms because I had to Google most of them. I wasn't aware of such unique titles that a doctor could actually specialize in and even excel in. What really charmed me and the reason why I was hell-bent on getting Dr. Prithika is her willingness to transform people, her 100-watt smile, and her zeal to transform the people around her for the better. In terms of rewiring your thinking for success, in terms of changing adversity to advantage, she has no parallel. And I'm sure with her answers and her insights into stress, you are going to be as convinced as I am. So again, madam, a warm welcome to Dr. Prithika Chary from all the eye doctors and other specialty and non-medical people in this group. There were only 2 things Dr. Prithika promised or got me to promise. One, that this program should benefit the maximum number of people. And 2, 9 p.m. is our bedtime. You better close the program before that. So those words, I'm going to get started. And I'm going to stop sharing my PPT. And so this is going to be a Q&A session where we are going to ask questions to Dr. Prithika. Some of the audience also has questions. Some of them have posted it through a Google form, which we have circulated in the last 3 days. The panel also can, of course, pitch their experiences and share some more of their questions. If the audience wants to ask a question, they can post it in the message inbox, or they can raise a hand. We will unmute and you can ask these questions. Dr. Prithika, I would like to open your innings with a small introduction, please. You are on mute, madam.
First and foremost, good evening to all of you. And a huge thank you to Dr. Aravind for considering me and trusting me worthy of being here this evening. I love people, okay? And I believe that my purpose in life is that anybody who I talk to or any place that I pass through should be better because I touch that life or pass through. And with that motivation, I have over the years not only looked at my patients, not just from their disease point of view, but also about their quality of life. See, all of us want quality of life. And when you're stressed, you don't get quality of life. So stress is something that exists. It's there for all of us. But there is good stress and bad stress. We all know that. And there's a limit on stress which we can handle, and a limit it can cross when it becomes devastating. So from that point of view, and we doctors, unfortunately, we know everything. We know exactly how to look after ourselves, but we are the worst in implementing it. And we've always got this excuse that we are doing so much for so many people that we don't have time for ourselves. So I always tell, especially women, stop being a candle. You are not here to give light to the whole world and melt and disappear in the process. Instead, be an oil lamp where you burn bright in your own flame. You throw light around you. You light other lamps. You can do all that you're doing. But please understand that you matter. And only you can look after you. There is no knight in shining armor who's going to come and rescue us. We have to take responsibility for our own well-being. And this is something that applies to doctors, non-doctors, to every human being. So if you want quality of life, first, understand that you need to take responsibility for your own well-being. So I think that is the introduction I wanted to share, and you can go ahead and ask whatever questions you want.
I'm sorry, I'm not actually here to interrogate you. We just thought that...
Please do. I have no issue about it.
Yes.
Please do.
We just found this format of asking pointed questions and actually being able to...
It keeps it on track.
True.
Prevents it from getting redundant.
Yeah, exactly. Keeping it interactive and involving more audience and kind of having a break from the routine. So this was a different kind of format we were thinking of. So this morning I was walking my 10-year-old son to school, and he has his midterm in maths. And as he was walking, he turned towards me and asked me, "Appa, do you feel tensed before exams too when you were young?" So I realized that from a 10-year-old to maybe a 90-year-old, stress is universal. There is nobody who doesn't experience stress. Like you said, there is good stress, which keeps you motivated and probably gets the best out of you. But at what point does stress become detrimental? Can we actually evaluate ourselves to find out whether we are stressed beyond a point where it is healthy?
To identify if you're stressed, you need to really, first and foremost, be very, you have to have your antenna out as far as your own well-being is concerned. As I told you, there should be an awareness in you. And when you have that awareness, you have to start listening to your body when it is whispering to you. When you do that, you will not be stuck to pull it down when it's screaming. So most of us wait till our body screams, mind, body, everything screams and says, listen, I can't take any more. Instead, if we start listening to the little murmurings and the little whispers that the body keeps giving us, like for instance, physically, like your son said, he probably was, his muscles were a bit tense. He's probably feeling kind of heaviness in his head. He probably felt a churning in his tummy. He probably didn't eat his breakfast properly because of the anxiety of the exam. So like this, we get little physical symptoms. But as doctors particularly, we get other behavioral and emotional symptoms. Because sometimes we don't even notice the physical symptoms because we are so committed and engrossed in our work. And one of the simplest, commonest physical symptoms that we see is you suddenly become more irritable. You start being a not so nice person. Everything seems a little edgy. You start having some mood swings. You find that your concentration maybe suffers. Your memory. Many people feel when they're stressed that their memory is defective. The reality is chronic stress can affect the memory because it can impact the hippocampus, which is our memory center. And the hippocampus is a very unique structure in the brain because in a very small area, square inch for square inch or square centimeter for square centimeter, a number of nerve cells are packed into a very small area. So even a small impairment can have a big external manifestation. So when you're stressed very often, because your attention has come down, your concentration and focus has come down, you begin to feel you have memory issues. And of course, all of us know that when we are stressed, our sleep suffers. We start, something keeps on going in our head and we get these racing thoughts. We start looking at things in a very negative way and it impacts our decision making. So you've got cognitive, physical, emotional, and the last but not least is interpersonal, where you'll find that somewhere or other you're misfiring in your relationships with your colleagues, with your partner, with your children. You probably lose your temper with your child more easily. When your son asked you, Papa, do you also feel tense before the exam? Oh, that might have been your response if you are stressed. Instead of giving him an empathetic answer, you lose your empathy quite a bit. So what happens? We start finding fault for little things. And actually, I have a little video which I'd like to share on this aspect, if it is okay with you.
Please do, madam. Please do.
Now I have to work out how to get it here. Right.
There's a share screen button on the
First, I
down
have to
panel.
open the video, then minimize it, and then go to share screen. Wait. Oh, yeah. Can you see it? Hi.
Yes, please.
In the 70s, 80s, and 90s, in my younger days, I was very driven. I was very motivated. I was succeeding. I was growing. But I wasn't a very nice person because I was very stressed. And I did not know that I could protect myself from the impact and consequences of stress ahead of time so that when stress occurs, I can handle it. And so what happened? When I was stressed, I would lose my temper. I would be very aggressive. I would be intolerant of small mistakes. Has this happened to you? I'm sure it has. All of us have gone through this because we all face stress in life. It's normal. But can we do something about it? Now, in my later years, with a lot of experience and expertise, I understand that we can create the concept of stress fitness just like we do about physical fitness. So I'm going to give you some tips today how to unleash your wellness and become stress fit. See, what happens when we are stressed? The stress can affect your brain negatively. It can literally shrink your brain. It can damage your body physically and mentally. It can damage your heart, your immune system, your sleep suffers. And unmanaged stress leads to anxiety and depression as well. But remember, in everything, prevention is better than cure. So you can become stress fit today. Very simple things. Remember that daily increments of just 1% can be compounded several times over a year. And this is the power of what James Clear calls as atomic habits. So how can you become stress fit today? Remember, self-care is not selfish. It is self-love. You have to prioritize in your life that sleep, exercise, and a balanced nutrition are important. You have to understand and manage your emotions. Remember that exercise produces very good hormones in the brain. It reduces stress hormones and generates your happy hormones. So with exercise, very often we start very well, we start big, and we give up. The trick is to start small and stay consistent. Remember that a balanced diet will boost your mood. So eat a plant-based diet. Drink lots of water. The body and mind require rest from time to time. And that is why our own natural cycles of the body have periods of rest interspersed with periods of activity. So learn to spend some time quietly. Just 10 minutes a day, sit quietly in absolute silence. If you can and you want to meditate, it will be good if you can meditate 15 minutes every day. Now, all of us know all of these. But why is it we don't do it? Because sometimes we are not able to stay motivated. We know the benefits. We know the good it's going to do to us. But somewhere within, there is a monkey mind which tells us, no, this is too hard. This is too, it's very hard to be consistent. And we persuade ourselves that it's easier not to do it. So if that is the case, don't be afraid to ask for help. There are people around you who can remind you to exercise, to drink water, to do and help you with your diet, etc. And they can actually help you in your journey to become stress fit. Remember, if you are stress fit, you become resilient and can withstand any challenge in your life. So become stress fit today. And all it takes is probably a daily ritual of half to 1 hour a day, where you sit quietly for a while, you read or listen to something motivation, you meditate for 10 to 15 minutes, you do half an hour exercise, and that 1 hour will set the frame for the whole day. And if perchance you have to face a life challenge or a health challenge, it won't bother you. The storms of life will not uproot you. You will stay grounded and you will stay strong. So get stress fit today. I think that sums up the answer to your question.
That was very impressive. In fact, you covered a huge space about mental wellness in that video. But you said something about being stress fit. So again, we did this survey and asked people if you have heard this term stress fit or stress fitness. But I guess this is a term you coined yourself.
Yeah, I coined it.
So what exactly? I mean, you have said that in your video, but how can people be stress fit? Is that something they should be working on?
Yes. It's about being mentally and physically prepared to be proactive when stress comes. And we handle the stress effectively. You have to have resilience, you have to have coping strategies, and you have to have underlying healthy habits. So it won't suddenly come. It has to be something that you work on and develop. And like anything, when it comes particularly to health, it takes time. You need patience. You need to persevere. And you have to make it a habit. Making it into a habit is where the whole essence of stress fitness lies. Because stress fitness is, it's already there in me, it's ingrained. And so when a challenge occurs, I don't have to stop and think how I should handle it. I already know. In fact, some of the ways that I would look at it would be it's a question of having the awareness. And for instance, if there is some unpleasant situation which occurs, the brain's natural negativity bias is there. So out of 60,000 thoughts in a day, we have about 40,000 negative thoughts. And there is an acronym called ANTS, automatic negative thoughts. So just like the little red ant, they'll niggle, 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 and the monkey mind will be at play all the time. That little voice will keep chattering. So when you look at a situation, you have to consciously, proactively teach your prefrontal cortex to override the limbic system, which has got this programmed thing which is going on for years of your life. And consciously, that awareness, you have to train that awareness so that you do what is called as taking in the good. We have this paramuri, so like that, you must learn that in that bad situation, there will be something good or something that you can solve, or you may not be able to solve it all, but at least you may be able to solve a small portion of it. So that habit of constantly taking in the good is something that you have to develop. And when you do that, that is in a way a kind of stress fitness. Also, this tendency for us to wallow in self-pity. Something happened to me, and so I know that I'm never going to get out of this catastrophe. We make everything a catastrophe. So all this is very normal because your negativity bias, the role of the brain is to keep you safe. So it's all the time looking out for danger. But you have to convince this pre-programmed mind, which has been programmed by the time you were 7 years old, that you have to always look out for danger because you don't know when something is going to attack you or this thing. So you're looking for the tiger in the bush when there is no tiger in the bush even. So when I say stress fitness, that's what it is. So you have the ability to adapt to something that is not your usual experience. You're able to adapt to change. You're able to overcome a setback. And you're able to persevere even in the middle of adversity. And so your adversity quotient is very high. And instead of being a quitter or a camper, you become a climber and go to the top of the mountain.
That's a lot of analogy. I understand. Adversity quotient. I guess it should be a new term we should add into our dictionary. And I get the point. Like if a marathon runner starts small, prepares himself by warming up and trains his runs to face an eventual challenge, you're suggesting that we also train our minds to be ready for an upcoming stressful event, which we can actually not predict in the current present. So Dr. Ramesh Rajan, our panelist, has shot in a question. Sir, I will unmute you. You can ask the question directly. You can unmute yourself and shoot the
Thank you.
question.
Is all forms of stress bad, or is there a difference between good stress and bad stress? And can we use the power of stress to improve ourselves or improve the situation?
Yes. I already mentioned that there is good stress, what is called as eustress, and there is chronic abnormal stress. Now, it has been shown that sometimes an acute stress, a fairly major acute stress, like say being in a traffic accident or something like that, is less traumatic to the brain than chronic, moderate, ongoing stress. The damage done by chronic, ongoing, moderate stress is far, far more. So we need a certain, there's a bell curve for stress. So we need a certain amount of stress to stay motivated, to be inspired, to do things, to achieve our goals, etc. But then there is a level at which it reaches, and if it crosses that level, then it is a downhill path, which ends in burnout. So you need to be alert, like I said, when you're crossing from here into that. Now, for instance, like I mentioned in the video, I was very driven, I was very successful, everything was going fine. But I did not even realize that I was stressed. Only when, everything started falling apart around me, I realized, oh my God, what is this? What is happening to me? I was beginning to not recognize who I was. And I was, having friction, conflicts around with people and with my own ability to be productive. So you don't need to get to that, is my point. Now, in hindsight, I say that you can prepare yourself for that kind of thing. And because that realization came to me sometime I'm now 76, in my 50s, I was able to start training myself to start getting stress fit. And so during the routine health checkup, when I was diagnosed with the rectum cancer grade 3 in 2016 December, I could handle it. I didn't break down. They told me, if you don't take the treatment promptly, in 6 months, you got a 30 to 50% chance of not being around.
Amazing, ma'am. Amazing.
So I could handle it. See, I'm a single woman. I live alone. So it was not easy. How am I going to handle this? So I needed to sit down, weigh my options, check my resources. And the resources are not just the peripheral resources. Do I have enough money for the treatment? Do I know the right doctors for the treatment? I was wondering who will hold my head when I'm vomiting from chemotherapy. I was not worried about cancer. I was not worried about dying. This was a bigger concern for me. You see, so I had to sit down for a week or 10 days, analyze everything, track my resources, and I made up my mind on a few things. I gave myself 3 guideposts. I said, no matter how much anybody loves you, nobody else can suffer this for you. You jolly well go through this. So brace yourself to handle whatever is dished out to you through this. The second point was, I am a person who doesn't share my, inadequacies and things very easily. I don't share my vulnerabilities because I was always this free spirit, happy-go-lucky, but strong and carrying on kind of type. I had to ask for help because I always felt that asking for help was bothering somebody else. So I exposed my vulnerability, reached out to my friends, and my friends took me through the whole process beautifully. The last thing was, if diabetes didn't stop me, if a head injury didn't stop me, if hypertension didn't stop me, why the hell should this cancer stop me? So that is being stress fit.
Amazing, Dr. Prithika. I think sharing that chapter from your life puts a lot of this into context, and especially how being stress fit helped you pull along this particular life event. We have Dr. Sachi, who's okay, she joined us. Hello, she's a research scholar, I think, and she's come up with a question. I'm going to ask Dr. Sachi to unmute herself and ask this question directly about facing adversities when you don't have anybody to share it with. And I think this question is very relevant to you. And so, though you've actually answered it, Dr. Sachi, are you here? If you're not able to unmute, I'm going to ask the question myself. It becomes even more difficult when adversities cannot be shared and you're all alone battling the situation. Is there anything else which helps us? That's the question.
First point is to stop thinking you're all alone. Because somebody has already suffered it before you, somebody else is going to suffer it after you. So you are not alone. So you first have to get over that inhibition that you're all alone. And if you don't have anybody to share it with, there is professional help available. Reach out. But why don't we reach out? It's because we feel that somebody will see how vulnerable we are. Or somebody will get to know that it's okay to not be okay. Please understand that. None of us is perfect. So you have to get over that ego which is blocking you from letting others know that you need help. So you don't have to be alone. I had a very tough time, let me tell you. But because I reached out, it just sort of worked out. I'll give you a small example. Every time I went for radiotherapy, it is 3 minutes of radiotherapy. Okay? So I have to go and come back. That's about half an hour up and down. They told me that every time I come there, I must not have a caregiver or somebody. I must have somebody to whom, if there is a complication, they can talk to. Now, where will I go and find somebody like that? I can pay and get a nurse or somebody to come with me. But that's not what they wanted. They wanted me to bring somebody they could talk to if there is a complication. So how did I work it out? My colleague comes to Cauvery Hospital. Her driver would come, bring our physician assistant along. They would pick me up, take me for radiotherapy, bring me back, drop me, and go back to Cauvery Hospital. Easy. It just worked out. So you have to get resourceful. And let me tell you, if you get used to being resourceful and being stress fit over the years, this comes very easily to you. So that's exactly why I'm saying before something hits you, arm yourself, wear the armor.
I can see the armor in place, in fact. Dr. Premraj, our panelist, has a question, and I'll ask him to unmute and ask your question directly, sir.
Dr. Prithika,
Yeah.
Whatever you say, there is something called emotional coefficient.
Yeah.
We can measure, there are ways of improving your emotional intelligence, and that makes you fit for what you call a stress fit. What is your opinion on going through the scientific or the conventional way of getting fit for the emotional challenges?
Being stress fit includes physical quotient, emotional quotient, social quotient, how you mix in the thing, your adversity quotient, as well as your spiritual quotient. Now, all of these put together form your ability to be stress fit. See, without being able to regulate your emotions, how you talk to yourself, how you think about yourself, etc., and how you communicate and converse with others. In today's world, EQ is more important than IQ. All companies, they want employees who can get along with others. See, even in our own profession, if you've got this brilliant ophthalmic surgeon who can't get along with anybody, you're not going to be comfortable with that kind of person in your team. He may be the best in the world. Because all of us have to live with others. Man is a social animal. So we need to be able to have that emotional regulation. And emotional regulation comes with the way you think, because thoughts become feelings, feelings become actions. So the way you think is what we are looking at when we say stress fitness. It's also an attitude. That is why I said negative self-talk, for instance, can really damage your ability to manage your emotions. And many of us are subject to self-sabotage. We keep telling ourselves, I'm not good enough, I'm not capable enough, I'm not this. If somebody comes and compliments you, you have imposter syndrome. And say, hey, you did a great job on that surgery. One of those things. So you're not even willing to accept your own greatness. So all these thinking changes is what we do in our workshops when we train people for stress fitness. So it's a step-by-step process. Actually, we go through 9 steps over a 12-week period where step by step you're taken from each of these so that all these quotients are in balance.
Prithika, can you tell us about this workshop? Something interesting is coming up.
There's one workshop I've specially designed recently for medical professionals called Resilience Mastery for Medical Professionals. I'm planning to launch it on the 10th of March because I'm not in town till then. I'm going out for a holiday. And in that, it will be every Sunday from 11 a.m. to 12:30 noon, just 90 minutes. And it will be for 12 weeks. We have priced it at 25,000 rupees. And you will be getting throughout that period, in that week, there will be assignments given to you, which you have to carry out because it's evidence-based coaching. You will have to do the assignments and communicate in the WhatsApp group that you have completed the assignment, because only then will the impact of that stress fitness training get into you. And the reason for 12 weeks is it takes 66 days, 21 to 66 days for habit formation. So what we do is this little nudges we give you every single day through the WhatsApp group or even through a direct interaction. And that nudges builds up over 12 weeks. And in between, we'll suddenly send you, like today, I sent my Adversity to Advantage group, I sent them a movie on Tourette syndrome. It showed how when that chap has an incurable disease, neurological disease, which is socially embarrassing, how he did not allow it to stop him from achieving his dreams. So that will motivate them and make them think. So like that, we'll keep on, feeding you with various things in between. And up to now, we have done over 4 or 5 workshops in the past 1 year. And we have seen tremendous transformation within that period. The earlier ones, some of them I've done are rewiring your brain for resilience, boost your brain power, manifesting mindset magic. They were all 10-week programs. And we've seen tremendous transformation in that period itself. So, but after that, sustaining it is up to you.
That is important.
And no, we do offer, if you're interested in sustaining it and you need help, we do offer one-to-one coaching as well for a longer term. And there is a membership also that we have, where when you join the membership, because you have already done this program, every 3 months you can decide whether you want to renew the membership or not. So you can just attend all the programs that we do because you're a member.
Do you think a retreat, completely cutting you off from the general activities and then go to a separate place, stay there, like very many people do that kind of soft skill training, stay there will be more helpful than this fragmented training program.
Okay. After the retreat, how are you?
Good, great.
How much of
Great.
what you learn in the retreat do you continue to do for the rest of your life?
Yeah, that is
Have
what
you formed a habit during the retreat? Have you formed the habit?
no,
2 days
no.
or 3 days or 1 week is not time enough to form a habit. So
Good.
that is the reason why this is stretched out like this. Because in between, we are going to be monitoring, we are going to be fine tuning, we are going to be, adjusting depending on how you are able to handle it. And the other very important mistake most of us do is we don't take a break. I remember there was a phase in my career where I used to boast, I've not gone on holiday for 5 years.
Mhm.
I really did not go on holiday for 5 years at a certain stage of my career. So we have to understand that the body needs rest, and rest is not just a retreat. Rest is every single day. Our bodies have what is called as the ultradian rhythm, the normal rhythm. So we are good for 90 minutes, then we have a dip for about 20 minutes, then again for 90 minutes. That is our natural way through the day, our energy output. It's a natural ultradian rhythm like the circadian rhythm.
Right.
So we have to adapt to those things. I follow something called the Pomodoro method for my time management and for my breaks. 25 minutes, every 25 minutes, I take a 5-minute break. We do this 5 times. After that, we take a half an hour break. So you are able to be very effective, say from 9 o'clock to 1 o'clock or whatever. Then your lunch time is what you take a half an hour or 45-minute break. Your productivity will increase, your focus will increase. And in that 5 minutes, if you are sitting on a chair or something, get up, walk around, look out the window. If you can walk in the sunshine, let the sun fall on you, get some fresh air, whatever it is, have a chat, laugh with somebody, crack a joke, not at the coffee machine. That doesn't do the job. But move your body. In fact, Tony Robbins makes everybody jump in his workshop.
Yes.
Literally.
Yes. Osho does it.
Yeah. So what I'm saying is just move your body. I call all exercise, I don't call as physical exercise. I call it as pleasurable movement. So start thinking of your exercise as pleasurable movement, like dancing. Dancing is pleasurable movement. So even your exercise can be pleasurable movement. So it's the way we look at things, which is very, very important. I hope that answered your question.
Yes, very, very much. Thank you. Thanks, Dr. Prithika.
So I'll take this opportunity to direct this conversation to a more, I don't know if it's controversial, but since you suggested it, Dr. Prithika, we did this survey and we wanted to know if stress is perceived differently by men versus women. Out of 102 responders, most of the responders were women. So the review might be biased. Almost 67% were women. And women, I think majority agreed that women feel or perceive more stress than men.
Certainly.
Would you like to comment on that?
Yes, certainly, because for them, work-life balance is more of a challenge than it is for men, at least in our culture. Now, I'm going to put a question to all the men in the audience. How many of you help your wives out with housework at home? I can't see. I need to put the gallery view. Let me see. Wait, let me put the gallery view, then I can see all of you.
Dr. Mohan Rajan there, madam.
He's not there.
Will you raise a hand for him?
No. He leaves at 6 and comes back at 10. So he doesn't.
So that is the issue. So naturally, the women feel it more. They're doing, see, when I joined my DM neurology, when I joined my MD in medicine, I was one lady in a class of 20 boys. It wasn't easy. And then when I joined DM Neurology, I was the first lady to join DM Neurology in MMC. So I have been a woman in a man's world for quite some time. And it wasn't very easy. So sometimes when we were feeling the stress a bit more, I used to tell my male colleagues, listen, you come to work at 9 o'clock, I come to work at 9 o'clock. You operate, I operate. You do this, I do this. You drive and come, I drive and come in the same traffic. Okay? But Dr. Kalyan Raman once told me, you take class for the postgraduates on Sunday mornings. So I said, sir, you have a wife at home who will take care of your home. My home will not take care of itself. I will take class on any other day, but not on a Sunday, because I have to take care of my home. Whereas all the male colleagues were quite willing to take class on a Sunday. So that's just an example how the stress for a woman is completely different. And that is why I tell women, stop being candles. You are not a candle meant to melt and destroy your life. That trying to be so many things to so many people that you disappear in the process. You have to take charge of your life. Say, you are the captain of your ship. You are the sculptor of your life. Do it. So you have to learn how to set boundaries, how to say no. That is where the whole thing lies. The setting boundaries part of it is, like I told him, 9 o'clock my bedtime. That's a boundary. I may have offended the whole ophthalmic association by saying that, but it is my boundary. And it's okay for me to say it. It's not something offensive or this thing. But ideally, even if you don't close by 9, I don't mind. What I'm trying to say is, I let you know that I prefer
Absolutely,
it
ma'am.
not
I
to go
hope a
on.
lot of men don't get stressed today after the women suddenly realize that they are no longer candles but oil lamps to be lit. But I totally understand. In our Indian scenario,
Identify your limits. All of us have limits.
yes,
Okay. You have to first recognize what is your limit. What we most of us, most women do is they think they're super women. They keep on doing more and more beyond their limit. And they don't communicate clearly. And when they do communicate, they are not firm and they are not consistent. They'll say one thing today, one thing tomorrow. And many people, men and women, don't know how to say no. And especially in our profession, like for instance, I'll tell you, many years ago, I used to see about 40 patients when I was in Apollo in a day. So into the clinic will be 8:30 in the evening. And a patient will come. I'm from Bangladesh. Please see me today. I'm going day after tomorrow, whatever. So I used to tell them, I could very well have just seen them casually, pocketed the fees, and that's fine. They won't know the difference, write some investigations. That's what many of us do. No, I don't agree with you. Somebody is putting in the chat, sometimes saying no is more stressful than doing. You have to learn how to do it. We teach you that. So, like this patient, what I used to tell them is, see, if I'm tired, I've been working all day, I'm hungry, okay? If I see you today, I will not be giving you my 100%. Are you comfortable with that? Because you won't know the difference. I'll just simply see you, write some tests, and that's it. 99% of the patients say, sorry, madam, we will come tomorrow. Nobody wants less. They want all of you. So communicate when you can give all of you. Whether it's in a partnership, in a husband, wife, child, whatever. You have to plan your life a little better, where you have portions of the day in for you, that you too matter. For that also, I've got a little video. It's a very short video, 2 minutes.
please
Can I
go
play
ahead, ma'am.
that?
Yes, please.
It's not come.
No,
You
that
see it?
self-advocacy
Yes, we can see the video.
is one of the very important qualities you should have if you want
Video is
to
not.
take care of yourself and you want others in and around your.
Wait a minute. The video is not playing. You're only hearing the sound. The video is.
Yes, only the audio is coming.
Yeah, I don't know why. Okay, shut it down and stop share. I hope this is all right with you people by doing this, because I think it's a better way of communicating what we are trying to say.
Sure, madam. Actually, the first video was shared among our FFA members, and Dr. Prithika was nice enough to share it as a guest faculty. Some of us were given an overview about stress fitness.
Okay.
Did you have your video ready?
I think it's ready. Let me see. If it doesn't work, it doesn't work. It works.
I will ask Dr. PPS to be ready with his next question as the panelist.
Do you know that self-advocacy is one of the very important qualities you should have if you want to take care of yourself and you want others in and around your surroundings to allow you to take care of yourself. So for self-care, you need to experience and express self-advocacy. Now for self-advocacy, you need to learn how to communicate your need, that you are important, that your needs are also significant, is what you're trying to communicate. So you have to learn to use statements where you say, I feel overwhelmed, I feel tired, I feel. So use I statements. Also, one of the ways for self-advocacy to take root is for you to set boundaries. And setting boundaries is not being selfish. Setting boundaries means you're telling people where you end and where they have to end as well. That this is your personal space and that you need to be in your own personal space and we cannot invade each other's space. So saying no is an important way of setting boundaries. So be very firm, be very specific. Don't keep on changing, vacillating, saying no one day, yes one day to various things which are there in your life. So when you say no, so much and no more, be specific and be repetitive and persistent on the same ideas. Advocating for yourself is your personal responsibility for your personal well-being.
So that
Thank you. I think
summed up what I was trying to tell you, that self-advocacy is very important.
and I think it applies to all of us as professionals, as family members, setting your boundaries and learning to say no and being persistent and consistent on it.
If we let our patients, they will just eat us up. They will come anytime. They don't follow rules. They don't obey instructions. But we have to give 300%. So we need to have that boundaries. We have to have some discipline with our patients.
Thank you, madam. I would now request Dr. Soundararajan, sir, from Salem. Do you have a question for Dr. Prithika?
Yeah. Ma'am,
Cholling, sir.
I have seen you in your young days. I am the cousin of Mr. D. Krishnamurthy, one of your patients, GBS. You pulled him out of death. I remember you as, it is in 1985-86, I think. Ma'am, I have got one small question for you. When you said you should say you are being overwhelmed or something like that, before advocacy. So when you are getting overwhelmed, how to come out of it? What are the tricks? And it's very difficult. Right now I am overwhelmed.
See,
right now.
when they diagnosed the cancer,
Yes,
I was overwhelmed.
yes.
I cried. I got depressed. I acknowledged my feelings. I decided it's okay not to be okay. I opened up to some of my friends. During the cancer treatment also, I put a rule that if any of you come and visit me, don't come and say, ஐயோ நீ இவ்ளோ நல்லவ உனக்கு போய் கேன்சர் வந்தது கடவுள் ஏன் உனக்கு இந்த தண்டனை கொடுத்தாங்க and all this rubbish. I said, if you come here, make me laugh or say something totally out of the way, let's have a discussion on quantum mechanics or something like that. So don't talk about this and don't come and feel sorry for me. Because when you read it, another mistake many of us make when we go, this is something I've seen again and again, when we go to visit somebody who has lost somebody, somebody has died in the house. Have you noticed this horrible thing that many of us do? We go there and make that person relive the experience. How did they die? When did they die? How did it happen? Don't ask that question. You're making that person emotionally break down because they are reliving that experience again and again and again. So one of the things to do when you're feeling overwhelmed is first distance yourself. Imagine that somebody else is overwhelmed and you're advising them. This makes a big difference because what you become an observer. It is possible to have pain but not suffer pain. If you understand what I mean.
Yeah, I do understand.
Yeah. See, I had an ileostomy pouch. It was awful because my skin is very sensitive and it used to burn 24 hours a day and I can't take it out. And so I spent 4 months sitting like this. I could not lie down flat, could not lie on the side, could not lie down at all, period. I either had to sit in a chair, sit like this with a back support or walk. That was it, 3 positions only. And that bag will suddenly leak at 1 o'clock in the night. All kinds of crazy things would happen. And I had to be on a special diet. It was tough. It was very, very tough. But the problem is, we've got some misconceptions about resilience. We think we have to put on this brave front, not show anybody how
That
tough
is where, yeah.
Don't do that. It's okay. It's okay. Acknowledge your feelings and say, look here, right now I'm not feeling okay. I need help. Or just let me settle down. Let me, be with myself. I used to play meditation music. So something like that. You have to, first, don't try to take any decisions when you're overwhelmed. Please understand that. Because whatever decisions you take, then will be wrong. Or will not be in your favor. So sometimes the pause, the power of the pause is what we call it. Even when we are angry, why do we say count to 10? That power of the pause.
Yeah, pause.
You're able to change the way you respond. So in life also, there are many instances where sometimes just when you're searching for something, we all know this. Sometimes we are searching, then we leave it. After 24 hours, we'll find it. And it would have been somewhere very obvious. So sometimes it's better to let go. And certain things you have to decide, you have to walk away. So for that discernment, you need to know what you can control and what you can't control. So if you break your head with things that you can't control, you will remain overwhelmed. So in that situation, find what are the things that you can control. And marshal your resources to work on those. Like what could I control? I could control how much money I put away for the treatment. I could control which doctor I chose to give me my treatment. I could control which hospital I'm going to get my treatment. when I started when I got the diagnosis, I wasn't quite sure I could control who's going to be with me. But then over time, that worked out. For that, we sought out help. So that is the way we have to deal with overwhelm. Because like I said, you have to rescue yourself.
Yeah, that's what.
At the end of the day, you have to rescue yourself.
Nobody is coming to save you.
No, there are people who are, see, another thing mistake which we make is, see, lots of people want to help us, but we don't tell them how.
Yes.
That is very, very important. So they come and say, they don't really know what to do for you. So I told my friends exactly, you do this, you do this, you do this, you do this, you help me here. See, I had a special diet for the ileostomy. And my friends gave me food 3 times a day. One day, 3 people brought food on for dinner. So I told them, put a duty roster. That's it. As simple as that. There was
Wonderful,
another
wonderful.
instance where again they said, somebody whom we can talk to should be sitting beside your bedside. So I sent a WhatsApp to 30 friends of mine and told them, how many of you can do bedside duty for 3 hours? One slot is 10 to 1, one slot is 2 to 5, one slot is something else. You don't have to do anything. You simply have to sit in the room. You bring your own laptop, you bring your book, you do what you want. You listen to your music, you do, but you simply have to sit in the room. So,
being present.
Yeah, because that's what the doctors wanted. So 12 of them replied. So we put one duty roster.
Dr. Prithika, for the kind of resilience and planning that you have, I'm sure even stress will feel stressed trying to tackle you.
No, I'm not going to let that beat me. My comeback will be better than my setback. The rest of my life will be the best of my life.
Awesome, awesome. I can actually
That's
imagine
it.
you with, punching gloves, punching the hell out of stress. But I'm going to direct this question. Thank you, Dr. PPS, sir. Back
Thank
to
you,
a
thank you.
survey and about 102 responses about which part stresses you the most. Most of the stress was about unmet goals and expectations. Most
Yeah.
of us have set these unimaginable expectations out of our own self, and we are not able to meet them. How do we handle this kind of stress, especially in the age of social media?
So first, sit down with yourself and do what I call as a self-audit. I advise everyone to do a self-audit once a week, 1 hour. What went right this week? What did not go right this week? What went right, I will do more of. What did not go right, I will see how I can correct it. Then I will also sit down and ask myself, do I need that? So, where we make unmet needs, you said, the unmet needs are because you're not sure what you want. 99% of the time, you have no clarity on what exactly you want. So you need to sit down and say, okay, I want this. Okay. How will it serve me? If I don't have it, how will it impact my life? If I have it, at what level do I want it? So like that, you have to sit down, and there are journaling prompts in our workshops. We give you journaling prompts and ask you. Journaling is a very good way of doing this. In fact, in our community, we encourage you to write 3 journals. One is a gratitude journal, which I have been writing for 35 years. Every morning, I write 3 to 10 things for which I'm grateful. So even in the middle of the cancer, in the middle of the ileostomy burning, even now I still have some residual leftovers of that thing. I have a rectovaginal fistula. I have IBS, which flares up periodically. I have a stent in my left ureter, which got kinked because of some vessel going past. But I'm grateful I'm able to do this. I can walk, I can talk, I can see, I can jump, I can dance, I can exercise. So I'm happy. So I choose happiness every day. And all of us have that choice. We think we don't have the choice. That is what stops us. So choose in the morning when you wake up. Choose that today is going to be a wonderful day. Something spectacular is just around the corner about to happen to me. How do you think your mind will be when you go out? You will be raring to go. You're not going to be tired. You're waiting for that day. So live in gratitude, because gratitude is great for the brain. It brings out dopamine, oxytocin, serotonin, and endorphins. It liberates all those neurotransmitters, which does fantastic things to your neuroplasticity. So you choose happiness. And you said unmet needs. You have to first identify what you really want. 90% of us do not know what we want. Like for in my case, I was very fixed on my career. Okay. I had a tough time. I didn't have too much support. I didn't have a godfather lifting me up. I didn't have, all of those things were not there. But I was very clear where I was going. And it's just like driving a car. When you want to go from point A to point B, when you get into your car, as you get out into the road, there'll be a ditch. You'll have to turn, there'll be a diversion. Somebody will come and fall in front of your car. Something will happen. You'll run out of, you'll have a flat tire. Anything can happen. But that doesn't mean that you abandon the process of going from point A to point B. You overcome it and go. So when there are obstacles in our life, the obstacle is the way. You have to go through the obstacle, because you must be very clear where you want to go. So I was very clear what I wanted from my career. So if you supported me, fine. If you did not support me, if you pull me down, run me down, I don't care. I know where I'm going. I'll just keep going. It's your problem if you want to pull me down. So if you're very clear like that on what your purpose is, what gives you satisfaction, how will you have unmet needs?
A lot of respondents.
Another thing that you do is, all of us think we have to start at the top. So you have the bar is set too high. You have to climb the steps. You can't just straight away go to step number 10. So we imagine that we can go to step number 10. Maybe because you have a godfather, maybe you have some support, something. No, it doesn't work. You'll fall from there. If somebody puts you there, you'll fall from there.
A lot of our respondents are also postgraduates who are probably just starting out or just getting ready to start their career. And if you are addressing them and tell them you choose the path, be clear, start out right away, they may say, you are at the other end of the spectrum of your career, so it's very easy for you to tell. But for a fresh postgraduate, it might be a very difficult thing to say no, to be able to be that resilient. Do you have a message for them also?
Yes. Age doesn't matter. Where you are doesn't matter. You can start from exactly wherever you are. As long as you remember that you always have a choice. It is this feeling that we don't have a choice. See, as a postgraduate, when I finished my MD, actually I got into neurology by sheer accident. That was one thing I didn't want to do, because I felt it was too tough. But circumstances threw me there. And okay, I got stuck into that. So might as well do a bloody good job there. So give your 100% to whatever life gives you sometimes. Make it your advantage, adversity to advantage. Convert that adversity to an advantage. Learn to, this is in your control. And you'll find sometimes when something you're trying is not happening or it's failing, you're probably on the wrong path. The universe sometimes makes you fail repeatedly in something because you're on the wrong path. And those failures will put you into the right direction. Like the DM neurology, I told you. I just wanted to be a general physician. I didn't want to be any specialist.
Yes.
Because
That's
I felt
remarkable.
you have to be really clever to be a general physician. I felt that was challenging to me intellectually.
But the universe had other plans for you.
Precisely. So make the best of what happens around you. Understand that everything is as it should be. Honestly, if you have to get that wisdom into you. We think
Considering-
that we are controlling or managing or making things happen. You are this infinitesimal little thing in the larger picture of the cosmos. You don't control anything. It's all just happening. So the best way to face life is go with the flow. That doesn't mean you don't have goals, you don't have motivation, you don't seek things out, it doesn't mean that. It means that take it with equanimity, take it with grace. Trust the universe. Trust that things will go your way. Have faith. It's hard to have faith because you think you can control everything when you actually cannot control them.
Beautiful. It's nice to hear a spiritual concept from a completely scientific person who's been a neurosurgeon and neurologist through their life. Just before I pass the question to Dr. Nirmal Frederick, our president, can we ask you about the exercise for the raisins and the chocolate? Can we do it now?
Now, one of the ways in which you can change your mindset, improve your thing, is something called mindfulness. Now, mindfulness is about being completely in the present moment and being aware of whatever is happening right now, right here. Okay? And mindfulness, it's different from meditation. Meditation, you sit down, you bring this thing to focus, you work on trying to get your thoughts out of your head, and then you get into a different state of your brain waves. Whereas in mindfulness, you're very aware of everything that's around you. It's the exact opposite. But you can do a mindfulness meditation. Okay, that is stage 2. Now, mindfulness can be done by us in lots of daily activities. You can be mindful when you're brushing your teeth. Feel the toothpaste in your mouth. Feel it trickle. Feel the brush scraping your teeth. So completely experience that whole thing. Now, you can be mindful when you're having a shower. Feel the water come, trickle down your body. See, when I talk itself, you can get mindful. When I describe it itself. So experience that. That is called mindfulness. It's a very useful thing because it can give you moments of respite, moments of rest in busy days. And I've got a whole program for surgeons of when they can be mindful. Before the surgery, while you're scrubbing, post-surgery, between cases, between patient appointments. There are lots of opportunities for you to be mindful. And those little mindfulness activities can make all the difference on how you feel at the end of the day. So now we are going to practice mindful eating with the raisin or the chocolate. So what you need to do is you have to put the raisin in your mouth. Don't bite it. Don't. Just gently bite bit by bit. Feel the juice coming into your mouth. Go on feeling that. Keep on doing it more and more and more till you are able to extract little by little of that juice. Experience it. Do it. Because I'm going to end with a guided imagery for all of you.
I guess everybody who's logged in, can you please indulge us with your favorite sweet? Put it in your
Either
mouth.
the raisin or the thing. Try it because you will understand the power of this mindfulness.
I had a doctor
And
asking
when
if I
we
could.
eat every day, what do? When we eat, we just wolf it down. So you can start having your meals mindfully. You can start having your shower mindfully. You can start driving mindfully. So you can bring mindfulness into any kind of daily activity. You can operate mindfully. Most of us do operate mindfully because when we are operating, our focus is not on anything else. So that will give you a taste of what mindfulness is. When you're that fully 100% focused on that surgery that you're doing. That is mindfulness. So now put that raisin in your mouth. Just suck it. Actually, we normally do this with a Kamalaparam sola. Because what we do is make you take off the seeds, put in your mouth, and get each of those little things, inside that one sola to come out. And squeeze it, taste it, make the juice come. Art of Living workshops, they'll use the orange sola for you to understand the meaning of mindful eating. So how many of you did it? Because sometimes the Zoom, that's a big nuisance. You can't watch people do all these things.
Dr. Prasanna,
How
you
many
eating a
people did
Mysore
it?
pak? One of our doctors asked if a Mysore pak will do instead of the raisin.
No, whatever it is.
I granted him permission.
Savor it, flavor it. That is what I'm asking you to do. That is mindfulness. We have to learn to savor our food. 99% of us don't savor our food. We just take something. Okay, taste is not good. Taste whatever. This is the way we treat our food. So start mindful eating. It will digest better. It will nourish you better. And you will feel better. The other thing which I do is, before my meal, I thank the farmer who grew the rice. I thank all the people who brought the rice to my table. I thank the person who made my plate, everything. I say gratitude for all of that and then I eat mindfully. What do? We put on the television or we stand with the plate in our hand and walk up and down and eat. So you have to change that. So mindfulness will teach you how to manage. And postgraduate student, senior most person, everybody can do this. There's no restriction. Your life will change.
So after this exercise,
what we are having is a pregnant silence. Huh?
I think everybody is still mulling and chewing over the idea.
But very hardly anybody has put on their videos, which is also not a very good thing.
So this is like the online classes during COVID lockdown, where everybody was expected to. Vasanta madam has kindly switched on their.
Thank you, Dr. Vasanta. Because it's very difficult for a speaker to be talking to black boxes.
Exactly. I would request everybody to switch on their video.
So that I have the pleasure of knowing who all I met today.
Yes.
Thank you, everybody.
So many people have joined.
Such wonderful audience I've had. Thank you so much for joining. I'd like to close with a guided imagery meditation kind of thing, if you're okay with it.
Yes, ma'am. Please
Yes.
go ahead.
Okay. Now, all of you need to sit up straight in your chairs. Keep your feet on the ground. Your palms facing upwards on your thighs, near your knees. Close your eyes. And just take a deep, calming breath. Take a few breaths. Now take a deep breath and exhale. Another deep breath and exhale. One more deep breath and exhale. Feel a warm ripple of relaxation rolling down from the top of your head to the tips of your toes. Feel this ripple of relaxation fall from the top of your head to your forehead, your eyes, your cheeks, your face, your ears, the back of your head, your neck, the nape of your neck, your shoulders, your arms, your elbows, your wrists, your hands. Feel the relaxation go down your chest, your upper back, your lower back, your abdomen, your hips, your thighs, your knees, your legs, your ankles, your feet. Just relax completely from the top of your head to the tip of your toes. Now imagine yourself walking into a lush, grassy field. Feel the softness of the vibrant green grass on your feet. You are barefoot. You can feel the grass which is damp with the morning dew. It is cool. It is refreshing against your skin. In front of you, you see a majestic tree. Its branches are adorned with small leaves and droopy yellow flowers. The air is filled with the faint, sweet fragrance of the flowers, inviting you closer. As you approach, you feel the gentle warmth of the sun on your face. It caresses your face. A gentle, cool breeze embraces you. You feel a sense of peace. You feel a sense of ease. Now, while you're imagining this, heighten what you can hear, heighten what you can see, heighten what you can smell. Listen to the leaves rustling softly in the wind. A serene melody. It's complemented by the cheerful chirping of birds, which are hidden in the foliage. There's the soothing sound of water flowing over rocks in a nearby stream. This reaches your ears. The splashing of water over the rocks gives you a tranquil rhythm that resonates with your soul. You walk towards the stream, and the shore is lined with the soft, white, clean sand. With a smile, you wiggle your toes in the sand. You feel the sand trickling through your toes, and you feel its warmth. You feel its softness. A wonderful contrast to the cool grass from which you stepped onto this sand. Feeling beautiful, feeling wonderful, You find a perfect spot beneath the tree. You sit down and lean gently against the sturdy trunk. The shade is soothing, a gentle reprieve from the sun. But there is still a glowing warmth around you. As you sit there, enveloped in the beauty and tranquility of nature, take a moment to breathe in the fragrant air, to listen to the harmonious sounds around you, the leaves rustling, the birds chirping, the water flowing. Feel the textures of the earth. Let this peaceful landscape fill you with calm and serenity, washing away any stress that you have right now, leaving you grounded, refreshed, renewed. Nothing, nobody can hurt you here. It is your own special place, and you are peaceful, happy, and blissful. Just enjoy this whole thing. Heighten all your sensory inputs to appreciate your presence here. Feel the textures, hear the sounds, see the beautiful things around you, and just understand that all is right in your world, and nothing and nobody except you can create your reality. Now, as I count backwards from 5 to 1, just do what I tell you to do. Number 5, wiggle your fingers and toes. Number 4, return to this room and feel the chair on which you're sitting. Number 3, relax your shoulders, relax your body. Number 2, understand that you can be anything you want to be. You just have to make the choice. Number 1, gently open your eyes. So how did you guys like that?
It was just amazing.
So understand that guided imageries you can do for yourself. Somebody doesn't have to lead you. This is guided, but you can do mental imagery for yourself. So that is
Would
why
some
I
of
said,
the audience like to share their feedback?
yeah, I'd like to
quickly?
have some feedback from the whole
You can
session.
unmute
Please.
yourself and tell us how it was. Dr. Banaja, would you like to?
Good evening, ma'am. That was a really different feeling. Really, we felt rejuvenated, refreshed, having a feeling like as a child, we get some encouragement from some elders. We feel really happy. That way, when you gave them guided meditation and told us you can be anything you want to be, really felt that. Thank you so much.
Thank
Dr.
you.
Ramesh from Karur, sir, தமிழ்ல சொல்றீங்களா மேடத்துக்கு?
மேடம் அமேசிங் அமேசிங். அதாவது this is a condensation of my 60 years of search. ஏகப்பட்ட புஸ்தகம் ரமணர்ல இருந்து எக்கார்டோலையில இருந்து என்ன படிக்கணுமோ எல்லாம் படிச்சாச்சு. அத்தனோட கண்டென்சேஷனை ஒரு ஷார்ட் ஸ்பெல்ல ஒருத்தர் கொடுத்தது இதுதான் ஃபர்ஸ்ட் டைம்.
ரொம்ப நன்றிங்க, ரொம்ப நன்றி.
Fantastic. No words to say. And moreover, it is not the theory that impressed us. The most impressive thing is your personal example. How you tackled your setback into something amazing. அதுதான் உண்மையில authentic presentation.
We have to walk the talk, sir. We have to walk the talk.
Exactly. Fantastic. Thank you so much. Thank you so much.
Dr. Prasanna, would you like to add something?
Thank you, madam. It was a wonderful eye-opener what we had today. We got a lot of insight from what you have told, especially from your personal experience. can relate us so many things what we also have gone through. Thank you so much, madam. Especially the guided meditation. Really, in the end, you made it feel that we can become what we wanted to be. Thank you so much.
Yeah, I thought
Dr.
today's Thursday, it's a working day. So all you guys would have been working all day. So I thought it would be a nice way to unwind you for the night. That is why I planned that.
One more thing I wanted to add. In the guided meditation, we were able to follow all the things you told. The only thing which I was not able to follow readily is the last step. You said open your eyes. I didn't want to open my eyes. I want it to be like that for another 10 minutes.
And you can. In future, remember that when we say open your eyes, you open when you are ready to open.
Yeah.
Because
Fantastic.
many people like that feeling.
Trance.
Vasanta, madam, would you like to unmute and give us your feedback?
I also used to feel when people go see somebody's grieving, they will add to their grievance. That I felt that you rightly mentioned that. And when you said that there is a pregnant silence, no, all of us were really silent, thinking about what you said. It was a very nice program.
Thank you, madam. Thank you, madam.
Nirmal sir, would you like to ask a question or add a comment?
No, I think we should
It's
try
okay.
to
It's
close
okay. It's
this
okay.
with
Time
the-
achina parvalla. We can manage. Yeah.
I am sorry for pulling her leg.
No, it's all right. It's all right. Because, see, I'm also enthused by the interest all of you are showing. So it's mutual. So it's okay. Don't worry about that time. If you are not worried, I'm not worried.
But good to relive because I had this guided Tibetan meditation few years back. It was like reliving those days and learning. And like Ramesh said, I'm just copying feedback from one of our former presidents, Dr. Kandeya. So let me share it for the people here. And I also read it. I'm sure you can recollect him, ma'am.
Yeah, I know him. I know him.
Yeah. So just read from his quote, from his message. Hi, Fred. Good seeing and listening to Dr. Prithika. Brings back nostalgic memories of UG days in MMC. And I admire her resilience and attitude after all the health hazards. I think all of us who heard you today admire you for your resilience and walk the talk, really. And you have packaged Wayne Dyer, Louis Hayes, Abraham Hicks, Bob Proctor, and all others in an art. So it was a good revision of things. That was what I also felt. The good revision of the Tibetan meditation we had a few years back, which we have practiced day to day. So thank you. Thanks, President. And thank you, sir. So thanks for sharing. And thank you, madam, for sharing your life experiences as well as all your expertise and experience within this 1 hour or 90 minutes or so. It was a wonderful evening, Thursday evening for us. Thank you so much.
For those of you who are interested in joining our March 10th program, I will post it to Aravind, then he can circulate it to you people as to the details of that. And the last sentence I would like to say before we close is that life is meant to be enjoyed, not endured.
Brilliant.
Okay, all of us are enduring life. Stop it. Start enjoying your life. God didn't put us on earth for us to suffer. He does send suffering periodically because otherwise we won't appreciate the good. And remember that in the world, if there are opposites, always there are opposites. And there are seasons. So if you try to plant something in the winter, it's not going to grow. So like that, go with the seasons. There are seasons in our life. We have good summer, winter, autumn, whatever, spring. Go with the seasons. So adapt yourself to that season when you're in that season. You said the PGs needed guidance. That is the guidance. See, when you're a PG, there is a different thing that matters to you. But after a while, it changes. Our life is constantly changing. What was important to me 5 years ago is not so important to me now. So just go with it and work with what you can control.
Thank you. Those are some amazing closing remarks. Does anybody in the audience want to thank Madam directly? Dr. Anusha, Dr. Jayashri, I can see you on screen. Would you like to add a quick thank you? Dr. Ravikumar, I can see you are still driving.
Madam, a few books. Please suggest a few books.
There are so many self-help books available in the market, but I would strongly recommend The Obstacle is the Way. There's a book called The Obstacle is the Way. It's a small book.
Okay.
It's very deep, but it's quite an easy read.
Okay.
Many of these self-help books sometimes are difficult to read. And my own semi-autobiography is on Kindle. It's called OMG, It's Me.
ONG?
It's Me.
Okay. It's me. Okay.
Nice title.
It's only 250 rupees or something. So it's not a costly book. It's a small book. It's a very easy read. It's a semi-autobiography where, naturally I can't bare my soul, everything in my life, but we have lessons learned and that kind of thing. And one of the quotes from my book, which I would like all of us as doctors to be aware of is, see, discipline is necessary, but it is flexible. Deadlines are necessary, but it is stretchable. So don't tie yourself down.
I'm sure we're going to keep revisiting this video. It's going to be available on YouTube. And a lot of the quotes and a lot of the references that Dr. Prithika Chary put up are going to be guiding us for the coming few months. I'll just quickly summarize these points just for the benefit of people who probably joined late and for my own sake, because I'm a slow learner. So be stress fit, prepare, be proactive, look forward to stress being predicted in your life and prepare for it. It's okay not to be okay. Do ask for help, acknowledge your feelings, take a break, you deserve it. In self-advocacy, set your boundaries, learn to say no consistently and specifically. And when you're overwhelmed, distance yourself, give yourself time not to react, but to respond. Acknowledge your feelings. And the very best was self-audit. I think this is some kind of a practice we should all start. Every week, 1 hour, we take an audit of our own self. And this is a beautiful line. I would really like to end with this. The rest of my life will be the best of my life. Let us choose happiness. So with these closing remarks, I would like to propose the vote of thanks. Is that okay? I would like to thank the President, Dr. Nirmal Frederick, our Vice President, Dr. Sujata Mohan, for actually being the giants on whose shoulders we sit and launch these programs today. I would really be happy to thank Dr. Ramesh Rajan, Dr. P.P. Soundararajan, Dr. Prem Raj, who have been kind enough to be our panel. Dr. Prem Raj left because he has a 9 o'clock cut down. I thank Mankind Pharma, who have been the sponsors of this program for this educational exercise. Thank you all for the audience for your patient hearing and your participation. Of course, we will fall short of if we don't thank Dr. Prithika Chary enough for her wonderful words, the opening of our minds for mindfulness, being able to do visual imagery, and a lot more. And this is just a trailer, dear people. Dr. Prithika Chary has a lot more to offer in her courses and in her programs. If you're interested, I will share these links on our FFA channel and our FFA group. Please feel free to join and benefit. Thank you.
Thank you.
Thank you, madam.
Thank you, everyone, sir. Thank you, sir.
Drive safely, Ravi.
Drive safely, Ravi.
Yes, sir. Just
We're
now
not
started.
supposed to